Before I came to see Dr. Pero, I was suffering with chronic sinus infections and congestion and facial pressure, pain. So my family doctor had referred me to him to correct these issues.
When a patient comes in and complains of not being able to breathe, you have to address it in two different manners. The first is, do they have a functional problem? Is there something that is going wrong with how the nose is supposed to function? And the second one being, is there an architectural problem? Is there physically something in the way that needs to be corrected in order to improve the problem?
After Dr. Pero examined me, he ordered some imaging studies, and this showed that I had a deviated septum.
So when Ann first came in to see me, we talked primarily about the function of her nose. She had a pretty severe deviated septum to one side that was clearly blocking not only her airflow, but was also contributing to some recurring sinus problems that she had. And so ultimately we discussed correcting the deviated septum to correct not only the airflow through her nose, but also to help her with her sinus problems. At the same time, she had concerns about the external appearance of her nose, and so we addressed performing those at the same time, which for a number of reasons is not only easier, but technically beneficial to do at the same time.
Along with the surgical procedure for the repair of my deviated septum, I inquired if Dr. Pero could repair a small bump that I had on my nose. All of my family has it on my mom's side. I've always been extremely bothered by this bump, and he said sure, it would be a very simple thing to do, and I'm very pleased with the results.
So ultimately we did that. We addressed not only the outside shape of her nose while also addressing the inside of her nose. We were not only to improve her nasal airflow, but also correct her chronic sinus problems as well.
I'm forever grateful to Dr. Pero for fixing those issues and getting rid of the bump, helping with my self-esteem and loving my look a lot more.
Recovery is well tolerated. Typically we tell patients to expect to be out of work for 3 or 4 days. That could be up to a week in some patients' cases, but it just depends on the patient.
Dr. Pero and his staff, they're very helpful, and this made me feel very comfortable and confident going into the surgery.